Welcome to Inhale Life Conversations from the Chicago Asthma Consortium, where we explore science, stories, and solutions that are really shaping respiratory health in our communities. My name is Sharmili Nienhuis, and I'm an asthma physician at the University of Chicago and the host of this podcast. So today's episode really tackles a topic that's really near and dear to my heart, as well as very inspirational and can be a concern for many families, which is asthma and sports. For some, athletics really represent opportunity, teamwork, and confidence, but for others, particularly often those people, the children living with asthma, it can introduce like uncertainty, questions about safety, preparation, and risk. So we have two remarkable guests today who both bring their expertise as well as lived experience to this conversation. We have Dr. Nisarg Bakshi, who is a pediatrician at the Advocate Medical Group, and will help us understand how children and teens with asthma can safely participate in sports, from prevention strategies to talking about some of the treatments. We're also honored to welcome Helen Hammond Redding from the Christopher Redding Foundation, and Helen will join us to share her family's deeply personal story following the loss of her son to a severe asthma attack. But through advocacy and education, she's really working to ensure that no other family experiences the same tragedy. So today, again, we're going to be really talking about empowerment, prevention, and awareness, and why being prepared really matters. So first, I want to ask, this first question to both of you, and maybe I'll start with you, Helen, first, is that when families hear asthma and sports, many feel fear. Is that something that they should feel?
No, absolutely not. I think that children with asthma should be able to play sports or to exercise. If they have asthma, they just have to ensure that they are being treated and get that asthma under control. But absolutely no way should they sit out of exercise or sports.
Okay, thanks, Helen. Dr. Bakshi, from a clinician's perspective, how would you respond to that question?
Yeah, absolutely. I think it's understandable, definitely to have that initial reaction of fear, a sense of apprehension. It's important to keep in mind this is a really common condition. The general prevalence is about 12 to 15% in both kids and adults, and in kids it's about 10%. Um, and it's also, I like to kind of give this example in the clinic, especially to kids who have asthma. Lots of professional athletes, both historically and currently, have asthma. I'll give you some examples. Emmett Smith, if you guys follow football, pretty famous football player, and Dennis Rodman, sort of known for on the court, off the court things, very famously had exercise-induced asthma, and David Beckham as well, famously had exercise-induced asthma. So definitely should not be a restriction. I think it's important to recognize that it could be a risk and come up with a treatment plan, and make sure that treatment plan's individualized. But not only is exercise very beneficial for a number of reasons, physically, mentally, but it also does help strengthen the lungs and reduce the effects of asthma long term. So absolutely understandable to feel fear, understandable to be nervous, but absolutely not a reason that kids with asthma shouldn't participate in sports.
Okay, great. And then can you tell us a little bit, like, is exercise-induced asthma the same as having asthma? So,
Yeah, there's a lot of overlap, so broadly speaking, when we talk about asthma, it is a condition where you have different tubes in the lungs that often open up to allow more air into the body and sometimes constrict to push more air out. Asthma is where that process gets a little dysregulated, where when you're exercising or doing something active, you want those tubes to open up and allow more air in. But kids with asthma either don't respond appropriately and don't open enough, or they actually kind of paradoxically constrict, which is, of course, going to have, the way that you feel that is you're going to feel short of breath. You may feel wheezing. Um, Asthma, broadly speaking, is that condition. There's different triggers for it. Sometimes people will have their symptoms triggered by an illness, by cold weather, by severe allergies. There's different sorts of triggers for each individual patient. Exercise-induced asthma, and sort of what the name suggests, is where exercise induces those symptoms kind of most prominently. Doesn't preclude other triggers playing a role, but with exercise-induced asthma specifically, you're really focusing on how do we kind of preserve the safety of an athlete as they're being active, as they're kind of, putting, more stress on the lungs.
And are there sports that are like safer or riskier for kids with asthma?
It very much depends on the individual. There are some statistics I think that are worth sharing here. There's lots of studies on the prevalence of asthma and especially with exercise-induced asthma, different sports and kind of how, it can impact, prevalence of asthma. Right now with the Olympics going on, there was actually a survey done of Olympic athletes, Winter Olympic athletes, for the last round, and the estimate of Winter Olympic athletes that had exercise-induced asthma was as high as 55%. So
Mm.
pretty high, right? And of course, this doesn't mean that skiing causes asthma, right? But it does mean that there's a number of triggers to keep in mind. So when we talk about outdoor sports, there could be the cold weather playing a role. If for cross-country runners or for soccer players, pollen allergy or environmental allergies could be playing a role. But that doesn't necessarily mean that athletes that are interested in doing those things can't do those things. It just means that the treatment plan has to be individualized to take that into account. So, of course, indoor sports don't necessarily carry those same risks, but again, not a reason that somebody who is interested in doing something can't do that thing. Just means you have to take all these things into account.
Okay. And you kind of started to allude to like what are some of the things, there needs to be some sort of treatment plan or kind of prevention when you know that you have your asthma. It can be exacerbated by exercise or if you have like exercise induced asthma itself. And so what should athletes or, not necessarily only athletes, I think just anybody living with asthma that they know that exercise can trigger, like what should they do before practice or games?
Yeah, good question. And like you said, totally doesn't apply only to athletes.
Yeah,
Anybody
yeah.
going to the gym or doing something active or, playing basketball in the driveway, right? All these things can still apply. It depends on the severity of symptoms. Again, these things should be individualized. But generally speaking, warming up is a good thing for anybody with asthma. Going straight into sprinting and kind of putting your body at that high level of stress can worsen asthma symptoms and exercise-induced asthma symptoms specifically. Um, Sometimes, again, depending on the individual, taking an albuterol inhaler puff before you start playing can be helpful. People may recognize albuterol as the rescue medication. That's normally the one that you give when somebody's having an asthma attack. Sometimes, depending on the situation, we recommend giving a puff of the albuterol prior to starting practice or a game or going to the gym, going on a run, something like that. That will help reduce the risk of having, asthma symptoms as you're exercising. There's different inhalers that sometimes people use as well, and that's something again that would be individualized to the specific person and their symptoms. But those are a couple things that could be helpful.
Okay. And you kind of talked obviously kind of case by case as far as, somebody might need to take a asthma inhaler, or other medications to control their asthma. But do we see that what might be some signs to show that like asthma is not well controlled and does that contribute to like exercise induced symptoms?
Yeah, absolutely. There are some objective signs that we can look at. And, if you see a lung specialist or certain types of doctor's offices, they can actually map out the lung function. And that can be something that's really helpful for certain cases. Sometimes we'll put patients on a treadmill, and kind of start stressing the lungs and seeing how the lungs respond. So that's an objective way that we can see whether asthma symptoms are well controlled. Subjectively, sometimes people sort of report shortness of breath when doing a level of exercise that is less than what their conditioning sort of allows. I can actually give a personal example here. So I have exercise-induced asthma, and
Okay.
that's really why, I like to talk about this. I last year signed up for a half marathon. Um, it's midlife crisis, right? And sort of tale as old as time. But as I was, really pushing my body a little bit, I started to recognize that even despite going on runs that were longer, I was huffing and puffing more than, my legs were sore or anything like that. So I went up on the strength of my inhaler. And shortly after that, I mean, I really noticed a lot of progress right away. So oftentimes it is just that sort of subjective feeling of why am I huffing and puffing so much? Have done this kind of exercise before, or I've really been working on this. So subjectively, usually people kind of feel that. Sometimes people also describe a tightness in the chest. That's a common reported symptom. So really, if you are concerned at all, it's good to talk to a doctor and kind of get some of those objective measurements.
Okay, great. Um, I wanted to bring Helen into the conversation and just to help remind us, why this conversation matters, like why it's really important to talk about exercise and asthma and being active in sports. And I was wondering, Helen, if you wouldn't mind sharing Christopher's story with us.
Oh, absolutely. And this conversation is extremely personal to me. I lost my son, Christopher, at the age of 18 to an exercise-induced asthma attack. Christopher was a three-sport student athlete, had played on organized teams since he was 6 or 7 years old, baseball, football, basketball, and had never, ever had an asthma attack. He graduated from high school, was recruited to Drake University to play football, came home Thanksgiving holiday of his freshman year. The day that he was to return to school, he went for a jog. He was always working out, conditioning his body. So he went for a jog before his friends were to pick him up to take him back to college or to the university. And he collapsed just a block from our home while he was jogging. Um, it was the second asthma attack he had ever had, and it was exercise induced. He had been diagnosed a year before as a junior in high school while he was running track. That's the first inkling we ever had of asthma. Didn't know anything at all about asthma. They gave him an inhaler. We weren't educated. We didn't know that the inhaler had to be carried at all times. And, Chris was like, I mean, he had a body of steel because he was always working out. And who would ever thought that he would have, collapsed from an asthma attack? But it happened. And he died before he even got to the hospital. And so we just set out to ensure that no other family would have to undergo that same tragedy that we did. We formed the Christopher D. Redding Youth Asthma Foundation um, in 2013, which is about 10 years after his death. After I retired from a lifelong career in banking, we started the foundation. And our sole purpose was to educate other families, to advocate for equality in asthma treatment for the underserved community, to put student athletes on a level playing field by offering scholarships for them to go to college, which we do right now, and also to just participate in all the advocacy efforts that we could, whether it be in Springfield, Illinois, or at Capitol Hill, Washington, D.C. We've gone there to advocate for asthma as well. But again, sole purpose to ensure that no other family has to undergo the tragedy that we did.
Yeah. Well, thank you again for sharing that truly personal story. And again, I hope, you telling the story and, what we're discussing here will help other families, as you said, like not have to go through what you and your family have had to go through. So,
Mhm.
are there, it sounds like you definitely, since his passing, you have learned a lot about asthma. And
Mhm.
are there any sort of like red flags that you would, want like parents and coaches to recognize regarding, exercise induced asthma?
Well, certainly, if there's coughing, wheezing, shortness of breath while the children are exercising, those are certainly symptoms. and also ensuring that the parents that the children have asthma action plans.
Mhm.
And I'm always famous for saying that asthma action plan should go where the child goes. If they're going, I mean, their sports, their coaches should have a copy of it. They should have a copy at school. If they go to grandma's house, that action plan should go to grandma's house with them too, because it will let them know if the child is experiencing some kinds of symptoms. Depending on which zone they're in, they would know how to treat the child. And so it's extremely important that the children everyone is aware that the child has asthma and know how to treat that asthma. But I did want to also mention, Germany, that another thing that we have become actively involved in is, treating and diagnosing children with asthma.
Mhm.
We have always wanted to have a mobile clinic to go into underserved communities to provide specialist care to children with asthma. And so in 2003, we did collaborate with Mobile Care Chicago to bring an asthma van to Lake County, which is where our foundation is based. Mobile Care had been doing this for years in Cook County, taking asthma vans and dental vans to various communities. And so we have enrolled approximately 30 schools in Lake County since that time. And we actually go to the children's school and diagnose them, treat, and provide ongoing treatment to them. And so, they don't have to miss days from school because we help them to get their asthma under control. Another thing that we're doing as our foundation, we are working to try and get the Rescue Illinois Act, which was passed in 2023, to help put asthma medication in schools and also to train the staff at those schools. We are working right now with the 104th Assembly to pass what we call Christopher's Amendment. We've gotten two sponsors, one in the Senate and one in the House, to ensure that the medication is also on athletic fields or at sporting events, and also that their members of the coaching staff, athletic staff, are trained to know how to administer the albuterol to athletes while they're out there practicing or while they're traveling on the bus or whatever. So we have a few sponsors that are also with us on this. We're primarily working with Respiratory Health Association. We've also have the Illinois Association of Free and Charitable Clinics on board as a sponsor, and the Chicago Asthma Consortium.
Mhm.
And so, I mean, everyone realizes the importance that, because exercise-induced asthma can occur so frequently while children are exercising or playing sports, we all are realizing the importance of ensuring that those children are protected as well, when they're having their sports activities.
Yeah.
So that's just some of our efforts that we are currently engaging in.
Yeah. Yeah, I really love again kind of how you've really turned, the tragedy of your son's death into, really improving the lives of,
Mhm.
so many people, so many children, so many families, and,
Mhm.
even at a state level, and, potentially, hopefully, if that passes, maybe other states would adopt,
Mhm.
similar
Mhm.
legislation
Mhm.
to prevent these unnecessary deaths. Um,
Absolutely.
yeah, I wanted to ask, and definitely both of you can chime in, but I wanted to see like if a child has asthma, which and they're involved in sports as Christopher was, like how do you talk to the parents regarding like letting coaches know or letting their school know about their condition, and again kind of finding that balance of like we still want them to play but we want them to do it safely. So I'll pause there.
Mhm. Well, I think it's important that the parents do let the coaches know that the child has asthma and ensure that a copy of that asthma plan is with the coaches. Many children, as they get older, they're embarrassed to use their inhalers. They don't want people to know that they have asthma. They may not even carry the asthma. I know one myth that I've heard every time I'm out doing workshops or at health fairs is, yeah, my child used to have asthma, but they outgrew it. And I said, no, your child does not. Then they don't outgrow asthma. It's important that the child carries that inhaler at all times. And I tell my personal story.
Hmm.
And so we've got to dispel that myth, and we've also got to try and help children understand that how critical it is that they do have an inhaler with them at all times, and what could possibly happen if they don't have the inhaler. Um,
Yeah.
Yeah, I completely agree with that. And the only other thing I would add is the importance of inhaler technique. I try to stress that in the clinic um, because if we take all the steps and make sure that kids have the inhaler and they know when to use it, um, oftentimes they'll kind of put the inhaler in their mouth and take a quick puff, and that's not the best delivery method. There is a significant difference, as technique improves, and especially if you're treating somebody who does have moderate to severe asthma and either is actively having an asthma attack or is at high risk of one, the technique can make a difference. So I always try to stress, how to use a spacer, when to do it, how to take those big breaths and take multiple breaths, really reviewing that. And as the kids get older, really putting it, yes, absolutely. Coaches, it's important, parents, important, teacher, 100% agree. I also do think it's important for the older child, especially in the later teenage years, to feel comfortable kind of administering the medication to themselves.
Mhm. Great. Now, Dr. Bakshi, I think you kind of alluded to this earlier, but I wanted to kind of circle back to the idea of maybe it's not that exercise definitely can induce, symptoms, but how do cold air, pollution, and pollen also affects exercise-induced asthma symptoms?
Yeah, and oftentimes these things kind of run together too. They're not mutually exclusive. Air quality is definitely a big factor when it comes to asthma, and that can be a part of, when we talk about pollen, sort of allergy season causing these symptoms to flare up. Cold weather absolutely can do it. So everybody's triggers are a little different, and kind of knowing the individual's specific triggers is important in figuring out a good asthma action plan. Um, the one thing I'll sort of add here too is air pollution is important. Here in Chicago, just last year we had the Canadian wildfires, so that caused all the smoke in the air. That was one day where we had the worst air quality in the world, right? Not good, especially if you have asthma or you're an athlete that's going out to play a soccer game that day. So I try to recommend, at least, especially if you have moderate to severe asthma or you have exercise-induced asthma or environmental allergen-induced asthma. You can check on the weather app, and if you have an iPhone, if you scroll past kind of that like 10-day thing, it'll give you the air quality number. And so anything above 100, you generally want to take some precautions. So for context, that day, I think it was, I wrote it down, I think it was 157. So, excuse me, 174. So pretty high, right? So in that scenario, taking precautions, covering your nose and your mouth, you can use a mask, a scarf, a gaiter. You can use an N95, of course, that's going to be kind of the best version of that. Making sure your inhaler is with you, your inhaler and your spacer. If you're on a controller or a daily inhaler, maybe taking an additional dose that day. So, absolutely, these environmental sort of exposures can play a big role in asthma broadly, and then specifically with exercise induced.
Okay. And so I know we talked a little bit about obviously the treatment options are going to be a little bit different for other, depending on each individual, but when should families like consider referral to a specialist?
Yeah, it kind of depends on the specific doctor and the specific situation. I'm a primary care doc. I try to do as much as I can, but I'm very cognizant of knowing the boundaries of my expertise. So for me, if somebody has, severe food allergies, severe environmental allergies, that's usually a sign for me to send them to an allergist to better manage the care. If there's ever, if we start a child on an inhaler and they're not responding very well, and we're concerned maybe there's a different kind of process going on in the lungs, or the asthma is more severe, then I usually send to a pulmonologist or a lung doctor. So in those scenarios, probably specialist care is helpful. A lot of times when we start the initial treatments and there's some improvement, but really we're kind of hitting a ceiling. There can be a role for more modern treatments like biologics, and that's something that would be better handled by a specialist. So usually, primary care doctors are majority of the time willing to kind of start on some of the first line medications and kind of triage for potential other causes of this. But beyond that, usually then we start asking our specialists to help.
And I know we kind of mentioned this at the beginning, but I know, Helen, also you kind of said, we have to dispel some of these myths about asthma, one of them being like people outgrow it. I think another one is that I hear often, even in my adult patients, is, well, I don't exercise because I have asthma, or, I was told as a child, or my mom always told me not to exercise because of my asthma. So, I mean, what would be a good message to parents that have children, with asthma, that they want them to be active, or to tell them like, I guess what might be a good message that you would tell them to encourage them like not to hold their children from being active.
Well, I think that not being active can lead to other kinds of issues for the children. And so definitely just encouraging them to make sure that the child is treated, that the asthma is under control, and that they can exercise, and I often cite, my child was in sports his entire life. All of my boys were. And so it's just exercise is good. It helps to prevent some of the other diseases as well. So just monitor the children, ensure that they have their asthma action plans and that they do go wherever they go. So.
Dr. Bakshi, do you want to answer that question from a clinician perspective?
Yeah, I completely agree. Lots of benefits to exercise, even outside of just talking about asthma and lung health. Um, yeah, I definitely, it can be helpful to kind of talk and find out where the nervousness is coming from. Like you were kind of alluding to, sometimes historical perspectives, right? If a parent was told by their doctor way back in the day, hey, you have asthma, take it easy, don't do this. Sometimes they pass that on to the child. So, making sure that that belief isn't there, because, that's of course not true. Um, yeah, so kind of seeing and probing and finding out why people are nervous can be helpful here. But yeah, totally agree. Exercise has a ton of benefits and we want to really set kids up for success, and exercise is a big part of that.
And I think, Helen, maybe you're alluding to that, not being physically active may lead to other problems that can also exacerbate asthma, which I'm thinking maybe you're thinking about like obesity. So I don't know, Dr. Bakshi, if you want to talk about that a little bit as far as how obesity, can impact asthma.
Yeah, absolutely. Um, obesity, and there's more and more evidence that is coming out about kind of obesity's impact on all the different systems in your body. Um, when the body's obese, the all of the extra cells that are there, they put your body in this kind of constantly inflamed state, right? Oftentimes, people will describe it as a sense of fatigue or aches and pains, just not feeling good. And part of that kind of pro-inflammatory state that comes with being obese can worsen asthma symptoms. So, of course, part of the treatment for asthma is treating obesity and making sure that the child's weight comes down if they are in that obese range. So it can be a little bit of a catch-22, right? It's like how do you get somebody to exercise and lose weight if when they exercise their asthma symptoms flare up, right? So it can be tough. But I think instilling confidence in the child and making sure, look, we're on a good plan, you should definitely feel comfortable exercising. And then making sure we are on a good plan, right? Making sure that they're on a good inhaler regimen or anything else that they need can be really helpful, in bringing down their BMI and ultimately helping their asthma as well.
Yeah, and I think one of the things too, as you mentioned, is making sure that they're talking to their doctor to make sure that their asthma is controlled so they can, safely participate in sports. So definitely having that communication with your clinician. So Okay. Well, I think we're going to start wrapping up. So just, I guess, again, if there's like one thing that you'd like to, impart about this topic before we sign off, that would be great. I don't know, Helen, if you want to say one last thing.
As I mentioned before, that myth has always bothered me. Your child does not outgrow asthma. Just still be careful with that child and ensure that they do have their inhalers and that they do have their asthma action plans and that they are warming up before exercise or that they are taking a puff-up inhaler before they start their sports, that their coaches know that they have asthma. It's just so critical from my perspective, having lost a son, that all these processes are followed.
Thank you. Dr. Bakshi?
Yeah, totally agree. It's not like a mystery diagnosis, right? It's not a complicated, really challenging thing for clinicians to figure out or anything. And that's why I think Helen's work is so important. It's really a question of education and access to care. If we can educate the community on what these signs look like, and if we can make sure that they are able to access a clinician or somebody who can get them on an inhaler, teach them how to use it, get them on an asthma action plan if that's what they need, talk to them about the different triggers in their environment, can make a really, really big impact. And I think that's why, Helen's story is so important, and that's why this conversation is really important. And yeah, I would just encourage anybody who hears this and has a question about it or feels, hey, maybe, some of these symptoms that they're describing kind of sound like something I'm experiencing. Definitely, reach out and find a way to access, a medical professional. And definitely, I'm sure the Chicago Asthma Consortium can help with that. Lots of different community resources can help with that. Yeah, absolutely. The goal is to avoid, ultimately the worst outcome. But then, of course, in general, just help people, lead healthy lives and feel good.
Great. Well,
Thank
thank
you,
you so
Dr. Bakshi.
much. Yeah, again, just want to thank Dr. Bakshi and Helen Redding for sharing their experience, advocacy, and courage with us today. Our discussion really reminds us of two, I think, powerful truths that children with asthma can thrive in sports and exercise, and preparation really helps, can save lives. So with the right preventative strategies, proper inhaler technique, as Dr. Bakshi mentioned, also attention to some of the environmental conditions such as cold air pollution, that shouldn't really limit a child's potential. And I think as Helen's story illustrates, that asthma always must be taken seriously, and that people do not asthma is a chronic disease that is not outgrown. So we really do encourage parents, coaches, school leaders to review these asthma action plans, make sure that you're aware of what that is and how to follow it, and making sure that inhalers are accessible, like the Christopher Redding association or organization is trying to do for the entire state. And so we know and we can recognize some of those early warning signs of distress. And so, really, I think awareness and readiness can really make all the difference. So, again, I think if you'd like to learn more, there's resources at the Christopher Redding Foundation, as well as in the Chicago Asthma Consortium website. And just want to thank you for listening to Inhale Life, conversations from the Chicago Asthma Consortium. And until next time, breathe well, stay informed, and keep the conversation going.